So we'll start with basically the brain, right? So the hypothalamus releases certain hormones that trigger either the anterior pituitary or the posterior pituitary to release certain hormones. So let's start with the posterior pituitary. So posterior pituitary, it actually doesn't secrete hormones, it just releases hormones, okay? So there's only two hormones that the posterior pituitary gland releases, ADH, which is also known as antidiuretic hormone. And the other name of that is vasopressin. And then there's also oxytocin. So ADH, antidiuretic hormone, that acts on the kidneys, okay? So on the kidneys, what ADH will do is tell it to reabsorb water. It doesn't reabsorb any electrolytes, only water, okay? So then by doing that, it can help control blood pressure if blood pressure is low, or blood volume if blood volume is low, okay? So that is the job of ADH. And then with oxytocin, so oxytocin affects two different organs, if you will. So one of them is the uterus, and the other one is the breast, okay? So in the uterus, this is for either postpartum or during pregnancy. So during pregnancy, this will be activated to contract the uterus. Okay, actually, yeah, to contract the uterus during delivery of the baby. So one purpose is delivery of the baby, right? So that the mom's uterus can push the baby out. And then the other one is postpartum. What does postpartum mean again? After delivery, right? After birth. So then at that time, why do you think it's important to contract the uterus? Say again? To go back in place for healing. And what else? What do you think is more important than that? What do you want the mom to not have after she delivers the baby? Or what do you want to not happen? What else? Oh, wait, bleeding. Oh, okay. Bleeding. So in postpartum, so this will prevent postpartum hemorrhage. So oxytocin is actually activated by even just thinking of the baby, or when the baby is breastfeeding, or when the baby cries and the mom hears the cry of even any baby. It may not even be her baby. When she hears the cry of a baby and she's postpartum, it releases oxytocin from her brain, and then it triggers this, okay? Apart from triggering that, it also triggers the breast. What do you think it's gonna do? Huh? Lactate, good. So it's not lactate, but to release the milk. Okay, I guess that's kind of lactation, but usually lactation pertains to the production of milk, right? So this is the release of milk, which is why, you know, when the baby cries, her brain thinks, okay, the baby needs to feed. And so she also will start releasing milk. And again, it doesn't matter if she's hearing that baby cry or any baby cry. Or maybe she's at work and then she thinks of her baby. All of a sudden, milk is released because of oxytocin. Okay. So as far as posterior pituitary, these are the only two hormones that is released by it. Okay. So not much to remember there. And then if you remember that these are the only two hormones that come from the posterior pituitary, then you know that everything else comes from the anterior pituitary. Okay. So then in the anterior pituitary, so these ones are actually secreted by the anterior pituitary. The posterior pituitary just releases, okay? It doesn't create it. The anterior pituitary creates the hormones. So first one is, can you guys do me a favor and remove that, the trash can that's wrapped there? Thank you. So thyroid-stimulating hormone, so that's TSH, right, for thyroid-stimulating hormone. So the anterior pit releases that, and then it tells the thyroid gland to release 3 different hormones. So there's 3 hormones that come from the thyroid gland: calcitonin, and T4 and T3. Calcitonin, oops, that is the wrong color. What do you think that does? What does it kind of sound like? Calcium. So this, okay, now I'm bothered that it's not the same color. So what this does is it actually decreases serum calcium. Okay, decreases serum calcium. So basically, when it's too high, it's going to increase the calcitonin to do that, okay? And later on in a little bit, I'm going to talk about what the hormone is that does the opposite, that increases the serum calcium. And then these two, T4 and T3, they regulate, any idea? Not quite, because we have growth hormone somewhere else. That's TSH is different from GH. So those are 2 different hormones, but they regulate your metabolism. Okay, metabolism. So if there's a problem with your thyroid, it's either your metabolism is slow, which is hypothyroidism, or your metabolism is fast, which is in hyperthyroidism. Okay, so a part of metabolism, let's just kind of enumerate what are the things that happen that they regulate your thinking. Okay, your cognition. So if you have hypothyroid, your thinking might be a little slow, sluggish, or you might even say you have foggy thought process. You can't think, okay? Or if you have hyperthyroidism, sometimes what happens is your thoughts are racing, okay? Or you can't sleep. So if you, so let's put sleep. So if you have hypothyroid, you're very sleepy. You're always sleeping, you're always lethargic. If you have hyperthyroid, you have insomnia, okay? And then temperature regulation is also regulated by this. So if you are hypothyroid, you are always cold because your metabolism is slow. If you have hyperthyroid, you are always hot because your metabolism is fast. It's like you're overheating, right? Heart rate is also controlled by this. So what do you think happens if you have hypothyroid? Slow, right? Hypo, slow. If you have hyperthyroid, fast. You may even have palpitations. What is palpitations? Like you feel like you have butterflies on your chest, right? You feel like you're skipping beats, and sometimes you actually may skip beats, okay? Hyperthyroidism. Who asked that? Hyperthyroidism, because it's your metabolism is too fast or too slow. So for the skip beats, it's the too fast. Hyper, okay? And then your integumentary system, your skin. So people who have hypothyroid, what do you think might be wrong with their skin? Dry and would it be thin or would it be thick? What do you guys think? Thick, because it's slow growth, right? And then your hair, what about your hair? If you have hypothyroidism, what do you think will be the characteristic of your hair? Would it be thick and coarse, or would it be thin and, very thin? Opposite. Thick and coarse, because the hair growth will be slow, right? Hypothyroid. In hyperthyroid, it'll be thin, okay? And they might even lose hair, right? Because it's growing too fast. You get it? Okay. And then your emotion, your mood, not your emotion, your mood. So hypothyroid, down. So think of a mood that is down, depressed. Okay. So hypothyroid patients may feel like they're depressed, or they may have depression, but they don't have, any issues with their neurotransmission. It's just that their metabolism is slow. And then people who have hyperthyroidism, they may get anxious. They might get anxiety. Okay. Again, because of also that racing thoughts that they have. That's anxiety. Like when when you lay down and you can't stop thinking and you can't sleep because you can't stop thinking, you can't stop your mind. Okay. That could be from hyperthyroid. Yeah. An imbalance in typically it's your thyroid gland. So sometimes you might have an autoimmune disease, okay? And if you have an autoimmune disease, and this is in our slides, so on Thursday I'll talk about it in more detail, but there's an autoimmune disease that destroys the thyroid gland. So when it destroys the thyroid gland, then you don't have enough of the glands that produce the hormones. So then the hormones decrease. And then there could also be an autoimmune disease where it's irritating the thyroid gland. And so when it irritates the thyroid gland, it causes an overproduction, overstimulation of the T3 and the T4. Then it causes the hyperthyroid. Does that make sense? Or it could be the problem is in the thyroid gland, or it could be the problem is in the anterior pituitary. You could have a tumor, right? So if you have a tumor in the anterior pituitary, do you think it's just the thyroid gland that might be affected? It's probably going to be the other hormones as well, right? Unless so it's a primary issue. If it's primary, it's coming from the gland itself that produces it. Okay, secondary is it's coming from higher up, which is the part of the brain, the anterior pituitary. Does that make sense? Okay. So you're good with thyroid so far? You understand? Okay. So next is ACTH. Oops. So ACTH is adrenocorticotropic hormone. ACTH, adrenocorticotropic hormone. Okay. So adrenocorticotropic, what do you think it does? So the answer is right there on the name, right? So corticotropic is production, right? So cortical is your corticoid, the hormone from the gland. Adrenal is gland, right? So there's two parts of the adrenal gland, the adrenal cortex and the adrenal medulla. I did not include the adrenal medulla here because that's not so much an endocrine function, that's a nervous function. Because what comes from the medulla is epinephrine and norepinephrine. Medulla is the medulla the inner part or the outer part, do you think? The inner part or the outer part? Very good. Medulla, middle, inner part. Okay. Cortex is on the outside. Okay. So the cortex releases glucocorticoid, which is also known as cortisol, and then mineralocorticoid, which is also known as aldosterone. So glucocorticoid or cortisol, this is also known as your stress hormone. Okay, stress hormone. So this is released whenever you are under stress. Okay, and it doesn't mean just emotional stress, it could be physiological stress. When we say physiological stress, what does that mean? How do you get physiological stress? Illness, when you're sick. Okay. So when you're sick, stress hormone is released, and then what the stress hormone does is it triggers, well, it does many things. So stress hormone, this is also an anti-inflammatory hormone. Okay, anti-inflammatory, which means when you say anti-inflammatory, it will stop the inflammation, right? Anti-inflammatory. So how it stops the inflammation is it's going to decrease your immune function. Okay. So then when you decrease your immune function, then what happens? What are you not protected against? Illnesses, very good. Infection. Okay. So when that happens, you're at risk for infection. Okay. So this is true also for people who take steroids. Okay. Because these are steroids. So glucocorticoid and mineralocorticoid are steroids. They're called endogenous steroid. What does endogenous mean? Endo, genos, genesis. Where does it come from? Jayla? Where's the origin? Endo. That's right. You produce it, right? Endogenous. Okay. So that's one of the things that it does. And then the other thing that it does is actually, I'm going to separate it out. A minute to organize my colors. So the other thing that it does is it triggers the liver to go through a process. Anybody taking anatomy? Not yet. A process called gluconeogenesis. What does that mean? Gluconeogenesis. Beginning, what is neo? New what? Glucose, sugar, right? So the liver, because in the liver you have glycogen. Glycogen is when you eat carbs, the extra sugar that you eat, it gets stored in the liver as glycogen. And then when you need it, it gets transformed back into glucose, which is sugar. Okay. What do we need sugar for? So let me take you through the steps here. So when you have gluconeogenesis, then you're going to have hyperglycemia, right? What does that mean? What is hyperglycemia? Huh? Low?
Wait, high.
High sugar. Okay, so when you have high sugar, what do you need sugar for? Very good, energy. So then when you have cortisol and your liver does gluconeogenesis and then you have hyperglycemia, the insulin, which we'll talk about another time, maybe by Thursday, but I'll put it here. The insulin takes the glucose to where? To your cells for energy. Okay. Have you ever heard of an individual, like maybe, you know, those like during a fire, they all of a sudden become very, very strong and they can lift a piano, they can lift a person, they could say, yeah, they could move a car, right? They could carry 2 people at a time. Why? Because of that. Okay. Because they got extra energy from the extra sugar that their liver had released because of cortisol. Does that make sense? Okay. So it does many other things, but these are the most common things, okay, that I want you to associate with cortisol. Mineralocorticoid or aldosterone, what this does is it has another end organ here, because remember, these are, this is from the adrenal cortex, and then it triggers another organ here. So for mineralocorticoid aldosterone, it triggers the kidneys. And whenever aldosterone is involved, 2 things happen in the kidneys. Okay. One is the aldosterone is going to reabsorb, tell the kidneys to reabsorb sodium, chloride, magnesium, and water. Okay, so it actually helps regulate, again, blood pressure, if the blood pressure is low, volume, if the volume is low, okay? And then the other thing that it does, however, so whenever you think of aldosterone, I want you to also think about there's a trade-off. So when it's reabsorbing these things and it's increasing volume, it is excreting. What does excretion mean? You're taking it out, right? Not secreting. Secreting is production. Excreting, X is, yeah, exit, right? You're taking it out. Potassium. Okay. So whenever aldosterone is involved, this is the trade-off. These 2 things happen at the same time. Okay. So this regulates your fluid. So the other hormone is growth hormone. So growth hormone tells the musculoskeletal system to keep growing. So this is more abundant. So another name is somatotropin, more abundant before teenage years. Okay, childhood and before the teenage years. So on Thursday, we'll talk about what happens when it's abnormal. Okay. And then we have prolactin. So prolactin tells the mammary glands to do what? So remember, we already talked about milk release. So what do you think the mammary glands will do when prolactin is involved? This is when you say lactation, okay? Prolactin, lactate, lactation, or milk production. So prolactin produces the milk, and what releases the milk again? What hormone releases the milk? Oxytocin. Very good. So then the other one is FSH. We talked about this when we talked about the female reproductive, right? So follicle-stimulating hormone. But this actually affects both male and female. So in the ovaries in a female, it helps produce estrogen, and it also helps develop to produce eggs, okay, for fertilization. In the males, it helps produce the sperm. And then lastly, we have the LH, luteinizing hormone. And the luteinizing hormone in the ovaries, oh, this is wrong. To put it the other way. In the ovaries, it causes stimulation of the follicle. So the follicle is where the egg is released from, okay? And also progesterone production. So the FSH produces estrogen, the LH produces progesterone, okay? And then in the testes, it's necessary in the male hormone, which is testosterone in the testes. So that is partially the endocrine system. Okay, there's a couple more things that I'm going to talk about. But absorb that for a minute. And I'm going to turn the light on because people are getting lethargic. Any questions about this so far? I'm recording this, by the way, so I'll post it up on Canvas. You guys understand everything so far? It's going to take a while to absorb because it's a lot. Can I keep going? We have like just a couple more things to talk about and then we'll be done. Oh, you just, I'm like, are you raising your hand or just, okay. So you're good with this? So the other thing, apart from the posterior and anterior pituitary, I'm gonna put it over here, is the pineal gland. So the pineal gland, it releases another hormone. Anybody know what it is? Very good, melatonin. And what is melatonin for? Say again? Sleep, yeah. So it's not just for sleep, it's actually also for hormone regulation. Yeah. So sex hormone regulation, okay? No, serotonin, hold on, melatonin, okay. No, serotonin is for mood regulation. So melatonin is for sex regulation and your sleep cycle. So this is released increased when, do you think? Which part of the day or night? At night, right? Because it's for sleep, right? To affect sleep. And then it also helps with sex hormone production. Okay, so that's melatonin. And then we also have the parathyroid. I'm going to put it right here by the thyroid. So we have here the thyroid gland, right? And I told you that the thyroid gland, it produces calcitonin. Where are the parathyroid glands? They're actually attached to the thyroid, okay? So if you remove the thyroid gland, you cannot have a parathyroid gland because it's attached to it. Yes, ma'am. You cannot, no, no, not at all. So this is mainly for like teenagers. So during adolescence, it helps with that. If you're an adult already, don't worry about it. It's not going to change your sex. Just so it's more for sleep that you're taking it. And that's not a dumb question at all. Yeah. So, and the way that, since we're at that topic, the way that melatonin works is it works with your endogenous melatonin, right? So you have to take it and then also have sleep hygiene, meaning turn the light off, turn the TV off, make sure it's dark and quiet, and then it works better. So if you're not doing all those and then you want to fall asleep, it's not going to work as well. Yes, exactly. Because it also enhances release of your endogenous melatonin. Yeah, Not necessarily, because are you thinking that it might be releasing too much melatonin or not releasing enough? It might throw it off when you work graveyard shift, when you work night shift, because you're forcing yourself to sleep when it's bright, and then you're forcing yourself to be awake when it's dark. So it throws it off. And not so much that it throws it off, you're fighting it. You're fighting it. So if you then are night shift and then you're going to sleep during the day, you got to do the same thing. You got to make it dark and quiet, no TV, nobody bothering you. You got to have 6 to 8 hours of sleep, and then you can take extra melatonin medicine. Because if you don't, it's not going to work. Okay. So again, parathyroid gland, let me just finish this. That way you guys can get out of here. So parathyroid gland only has one hormone that comes out of it. Anybody know what that hormone is? It's going to be pretty easy. Thank you. You're so smart. So parathyroid hormone. The only job, okay, the only job of the parathyroid hormone is to increase the serum level of calcium in the blood. Okay, that is the only thing that it does. Okay. How does it do that? It's gonna talk to 3 different areas of the body. One is going to tell the bones to resorb calcium. So bone resorption means the bone is going to release the calcium. Okay. Because calcium is stored in the bone, yes? And then apart from that, it's also going to tell the kidneys to resorb calcium. So the kidneys also releases calcium. Okay. Calcium is actually the only hormone that goes low in chronic kidney disease and end-stage renal disease. It doesn't go high. Everything else goes up because they can't be released by the kidneys. Calcium goes down because it cannot be secreted by the kidneys, okay? Because that's its function. And then also in the GI system, it's going to absorption of calcium in your food. Okay. The problem is when you drink, like milk or like cow's milk, for example, that actually doesn't have vitamin D. Okay. So vitamin D Where do we get vitamin D from? So vitamin D, inactive metabolite. Vitamin D has to go through the kidneys to become active. Okay.
So vitamin D low is vitamin D low.
So without kidney function, your vitamin D is not going to be metabolized. So then you need the vitamin D so that you could absorb the calcium. And then when all of these things happen, oops. When all of these things happen, then you're going to have what is called eucalcemia. What does eucalcemia mean? What do you think that means, eucalcemia? Very good. So EU is the prefix that means normal. Okay. So emia, blood, right? U, normal. So normal serum calcium.